Good evening, Victoria here. Please subscribe to my channel. Today you're going to see lovely Phil, and Phil has had some sporting injuries, tightness in muscles. You get to see his whole core therapy, part 1 of his treatment. Part 2 is next week. Stick to the end to see how we're both feeling after the end of his Sacral Float, that lovely Qigong feeling. Okay, see you soon. So, Phil, welcome. You're going to have another core treatment today.
Yep.
How are you feeling?
Yeah, not too bad actually. It was weekend of golf, so a little bit stiff and
Whereabouts?
lower back problem.
Yeah. Okay. Have you been better since I've seen you?
Oh yeah.
Things improving?
Yeah.
How's the heel?
Okay, a little bit sore after.
So we had an Achilles heel issue,
Achilles
didn't we?
tendon issue, yeah.
Tendon issue, yeah.
Yeah. Which is it's torn slightly, but it is repairing. That was
okay.
Ago, so.
And you're playing golf, so it can't be that bad.
It's getting better.
Yeah. Good, excellent. Okay, let's give you a nice treatment.
Yeah, great.
So welcome into the Bothy Therapy Room with Phil. I am starting the treatment by checking with kinesiology techniques to see his strength emanating from his spine, his pelvis and neck, to see the alignment and whether his structure is supporting his body to the best possible extent. Having tested one of the kinesiology tests called an IPSI, I noticed that actually both of his IPSIs were weak, which can show dehydration. So having performed the dehydration test by pulling on the hair, which relates to the kidneys and therefore how much water is supported in the body, I noticed that he certainly was dehydrated, and just by drinking a glass of water it immediately has a positive effect on the muscles of the body, in that they will perform to their best extent, and this will then not be affected by any dehydration. So it is a very warm day on this day, and I did have the fan on, the windows open, so the dehydration is understandable, but it is so important for us all to be drinking water whatever time of year, all throughout the day. It supports our neurological, hormonal, digestive, respiratory, muscular and other systems. So I've now retested the IPSI test and noticed that his right side was weak. So I therapy localized, which means located the area within the back, at the very base of the back, at the hip level, where it needed support. Then I retested and it showed it was strong, which means that the body and his mind were confirming for me that I had got the right spot and that area would be considered going forward by his body and mind in order to start the healing process. You know, a lot of core therapy is all about the therapist having a conversation with the client's body and subconscious, whereby we are simply facilitators, finding out where needs a little extra help and then asking the body to continue the healing process itself, so it doesn't rely on a therapist. Having moved on and done a contralateral test, which means checking for things like the jaw and the other joints of the body, like shoulders, elbows, wrists, hips, knees and ankles, I noticed that Phil's right arm and left leg showed a weakness, and then spotted that his left knee and left ankle would need a little bit more detailed testing, but also some repatterning and treatment. So now you can see I'm looking at his left ankle. This is the ankle, as he mentioned in the earlier chat, that has shown a rupture. It's a small tear in the back of the Achilles tendon, and it has been producing some swelling and pain, stiffness, which meant that he wasn't able to play sports like tennis. But having had a couple of treatments and having been under the doctor, been resting it for a little while, he's now back playing golf, which is great news. The other test that I performed were something called a pitch, roll and yaw. Now that particular series of tests dissects the walking gait, which means all the different angles that our body gets into when it needs to walk, and including when it needs to start walking or to get out of a chair. That's the pitch, which I call the jaw jut. And some of those needed spotting, needed confirming to the neurological system that they needed more help. This one is called a psoas test, where I have the leg out at a 45-degree angle and up 45-degree. And I noticed that his right side, as you can see here, I'm on the right side, halfway down his back at about T11, T12, thoracic 11, thoracic 12. And it's very common, unfortunately. I see in the clinic a failed psoas test quite frequently. And it can mean it's a neck issue, or it can mean it's a lower thoracic and lower neck issue. And all of these will be treated in the second half of the treatment once I start giving the Tuina rocking Chinese massage. This is a wonderful test, and it is hard for Phil to do this one because when he was born with dislocated hips, and it wasn't spotted for quite a while. So his hips can be a little bit fragile and vulnerable. He finds in this position here with his knee out and it is an odd position for any of us to hold, actually, to have one sole against the other ankle. So that means that your hip is only partially, in a small extent, opening. And then I test it in a medium and larger extent before he relaxes back down. So all of these tests are like a little shopping list, and every time I find something that fails a test and it isn't as strong as it could be, then that little shopping list, not only am I constantly writing down in my notes, but also his neurological system, his subconscious, the part of the brain, the large part of the brain that deals with the subconscious, will be noticing all of this treatment, will be stacking up this little shopping list so that his own subconscious will be starting to register that that area needs help and realignment in this case. Now I'm looking at the digestive system. Now for every person, every treatment, each treatment's slightly different. You never know what the client's going to arrive presenting, meaning what symptoms they're going to come with, what sort of day they've had. But the digestive system, this particular place called the iliosacral valve, the ICV, I do tend to test and potentially treat on most people that walk through the door. It's one of those key areas that tends to grumble. It tends to not perform at peak in most people. Some people I test and it's absolutely fine, which is great. But to tell you the truth, that's normally those people that I've treated before and I've shown how to massage their ICV, iliosacral valve. And I do say to people, yeah, massage it as often as you like, maybe 5 times a day would be super, because then they get to know how their ICV feels from one day to the next. They take ownership back of looking after it and giving it a little bit more attention, a little bit of a more soothing massage if it is grumbling at all or if they are suffering with digestive issues. Now this is a wonderful test called the glute max test. So the glute maxes in the buttocks should be one of the strongest muscles in the body, especially for sports people. So Phil does play a lot of golf normally when he hasn't got an Achilles tendon issue, and a lot of tennis and other sports. And so the glute max should be a really strong muscle, but I've found that his right side glute was weak, and so I'm trying to locate the area in the body that is causing that weakness. And if it's one-sided, it's normally in the mid-lumbar, which is about the waist or around the waist level. And it can also be in the neck as well, which I will have treated and therapy localised, added to that little shopping list. So now I'm starting the treatment itself, having done about 10 minutes of kinesiology muscle testing. I'm now going to give a nice long treatment, always starting off at the spine. Now this type of massage is Chinese, called Tuina, and I'm using like a push and pull motion where I've got my thenar muscles, which is the base of the thumb round that side of the palm, into the side of the vertebra. I normally use one hand as a support and the other one to concurrently feel my way to see where there may be stiffness, tension, tightness, even a fixation or blockage, but also to give therapy. So one hand's always checking and treating and the other normally supporting. It all depends how the body reacts, how the spine is waving and curving and giving way to my pressures. It feels so nice to have Tuina. In fact, I had my own core therapy given to myself today. I do a swap with a good friend and it was recorded, so I will be showing that at some point. So nice to receive this therapy. You really feel like you're in good hands when this is being done. You feel like the therapist really knows what they're doing. They tend to find any hotspots, any areas that need more attention. And interestingly, we don't necessarily spend too long in an area that is painful or tight or stiff. What we'll do is leave it alone a while, make sure that it's warmed up, and then come away from it. Treat areas far away or near to it, and then come back and see if those other areas have had a calming, soothing, like a wave-like action on the tighter area, which will then soothe that area as well. It normally feels better even when you haven't been working on it directly. And then you can spend longer on that place to bring some motion. And what that will do is it will relieve the circulation, the lymph, the nerves that may be tight and congested around those tight muscles and vertebra in the spine. It's interesting with Tuina, quite often we treat the back and then notice that over time, maybe over weeks or months, other areas are helped by just moving the vertebra. So for instance, people suffering with acne, eczema, psoriasis, for instance, all skin conditions, may be helped once the circulation is improved to that area. So now coming around to the other side of the back, continuing with the Tuina, using fingers sometimes, and sometimes the base of my hands, quite often thumbs, in a beautiful rocking. It like takes us back to the cradle, really. Makes us feel really looked after. So it's especially important during Tuina to check out the sides of the sacrum, which is the base of the spine, which overlaps into the glute area, and the sides of the sacrum and the flat fused bones of the sacrum itself are greatly helped by a lovely rocking Tuina massage. This is a wonderful treatment. I'm not sure if I've shown you this one before. It's called a wing stretch. And I'm able, once the client has completely relaxed and given me the full weight of their arm and shoulder, I'm able to lift it in a way that I circle the top, the point and the scapula of the whole shoulder. And what that does is it helps relieve it from holding onto that rounded upper back part next to the vertebrae, the upper back, the upper spine. And once I've worked on that area, I then use my base of my hands to try and instill some fluidity in between the scapula and the spine. Sometimes the shape of our back can be misshapen because of the scapulas being too rounded and causing the tops of the shoulders to align forwards, and therefore misshaping and rounding that upper back, possibly not good, and brought on even more by leaning over a computer and sometimes by certain sports. And often I see it with people that are lovely and tall. They might also have a rounded back, but this wing stretch is so good for relieving that. People often find they walk away from a treatment like this feeling and looking taller, like there's more space in between each vertebra. And this is a lovely treatment where I'm walking down the spine, putting quite a lot of pressure down, not only down to the floor, but also down towards Phil's feet. So it's alternating hands, and this has the effect on the erector spinae muscles, each side of the spine, and therefore on the vertebrae themselves, of just shifting them left to right, but also down each way, so left down, right down. And now I have the flat of my palms on the scapula, both scapula. I'm just feeling into the energy. There's a lot of warmth there. I can see colours behind my closed eyelids. Sometimes I remind the client that they may well be seeing colours at the same time, which quite often concur with the ones that I'm seeing. They're definitely, client and therapists are definitely in tune in a treatment like this one. And now some foot repatterning. So I'm feeling into, in reflex terms, the shoulder. You can see a little bit closer here. So I'm pushing down on the ball of the foot and then down the kidney line, making sure the ball of the foot is separated from the rest of that upper part of the foot. I see this a lot where feet aren't given much attention. We don't love them enough, bless them. And this kind of treatment reminds the muscles and bones in the foot to relax and let go, and to actually release and spread out on the floor rather than tightening up. And now working into the ankle. So this is the ankle that was affected by the Achilles rupture. And this is some energy work using Qigong. I've got my thumb at the solar plexus. And the energy now is tactile. And now some leg repatterning, very gently moving the foot in a particular manner that actually works on the opposite hip. So you can see that hip rising the more that I rotate his foot outwards. I'm always mindful and careful of the knees in that position. Now working on Phil's right foot, again working into that shoulder, the ball of the foot, and using caterpillar strokes and touch up between the ball of the foot and the rest of that upper part to separate. It's even better when I use two hands, because then I can hold one area of the foot while rotating another area, and that encourages the muscles and all the different fascia to release. Phil's feet can be quite tight and constricted. And I often say to a lot of my clients actually, to when you're sitting, whether you've got shoes on or not, try and, when you've got your feet on the ground, try and spread your toes as if you're trying to occupy the widest amount of floor with all of your toes, and then feel each toe pressing into the floor and almost bring them back like you're stroking the floor from outwards to inwards. And that will help you to use each toe, use each muscle, but also to remind the foot that the toes and that ball and upper part of the foot need to be separated and relaxed. Now coming on to that lovely Qigong Sacral Float. So a float is a word we use when we give Qigong and we are concentrating our intention of healing at one particular place. This place is the lower vertebra of the back. And sometimes the back will give me an impression of moving, and my hands, quite often my eyes will be closed at this stage, so I'm not necessarily watching it, but I can feel all of it through my hands, and my hands will take on that movement. And because of the chakras in this area, the sacral chakra, it may well form a circular, very gentle and slow rotating movement. At this stage, the client would definitely be seeing colours behind closed eyelids. I normally see quite a lot of colour at this stage. They can be any colours of the rainbow, all relating to the chakras opening. Quite often therapists giving core may spend anything from maybe 3 or 4 minutes up to 20, 25 minutes just in this position. The feeling is so beautiful and so healing. It has such an amazing effect, not only on the sacrum, but the whole rest of the spine, the neurological, the nervous system, up into the brain, the cerebral spinal fluid, the lymph, and therefore it creates a beautiful well-being that we call neurological organization, where the nerves are talking to the lymphatic system, which is our toxin removal, our immune system. Most clients are utterly relaxed at this stage. There's hardly any shifting and tweaking. They're completely very, very deep in a sense of soma, a sense of like a meditative state. And once I've cleared and ensured that the sacrum is rotating in a lovely manner, I place one hand at the very top of the spine, the base of the skull, and feel the energy travelling between the two. So this again will be watching for that cerebral spinal fluid as it pumps through and up and down the spine. I very slowly bring Phil round, some breath work, some awakening, some small movements of hands and feet, before he then turns over, ready for the rest of his treatment. Hi, Victoria here. I'm excited to bring you the second part of Phil's core therapy treatment. Please subscribe to the channel and welcome as a fly on the wall in my Bothy Therapy Room, where you get to see Phil's second part of his treatment. Stick to the end to see whether he passes the tests that he'd previously failed, the kinesiology tests, and to see how he feels, whether he's moving well at the end of the treatment. Okay, see you soon. So, welcome to the Bothy Therapy Room. I invite you in as a fly on the wall to watch Phil's second part of his treatment. In the first, you will have seen the kinesiology muscle testing to see how he presented this day. Then you get to see the Tuina massage, the shoulder work, the leg repatterning and the Sacral Float, the Qigong. Now he's just turned over and I'm checking his alignment, but also working on his feet, his toes, soles. I'm using my thumbs down the line, the center line of his foot, which is actually the reflex point for the whole spine. And I'm also working around the sides of the ankles because he's had a left Achilles rupture. I'm aware that Phil may be a little uncomfortable with this. That's why quite often clients will shift around once they first turn over in order to resettle the body. And because of that Achilles pain and lack of mobility that he's had for a few weeks now, this has meant that any work on this area may feel a little bit new, a little bit uncomfortable perhaps, and yet it's well received. It's the sort of feeling you get that feels like a relieving pain, one that needs to happen, sort of pokes the pain a little bit and gets rid of it. Working around the whole side, the lateral whole outside of the foot and ankle, in order to relieve any tension of the muscles and fascia around that Achilles. This is what can happen quite frequently with any issue in the body, not just the Achilles, whereby other tension and lack of alignment perhaps with bone and muscle will lead to too much strain in a different area. And that may be what's happened in this area. And of course, Phil is quite a sportsman. He enjoys tennis and golf particularly, which are both one-sided sports. They're not symmetrical. And so this may well have been putting too much strain on those finer joints, those finer fascia ligaments. So I've now propped up Phil's left knee with my knee in order to create heat underneath the knee. I've got my hands on top, creating that dual targeted effect of heat and Qigong, but also to bring the knee into a soft alignment so it's not locked. You may notice I'm moving around a little bit. That's as I sense the energy coming from Phil's knee. You notice also that Phil's stopped moving around quite a lot now. This will be because of the energy created when Qigong is happening. It's such a profoundly intense, relaxing effect on the whole body. Phil will now be experiencing quite a lot of heat in the knee. I'm just working my thumbs around the outside of the joints. And now coming to the top of the body, the head, shoulders, neck, the scalp. The reason I worked on the left knee just now was because you'll have noticed in part 1 of Phil's core therapy treatment, it was his left knee and left ankle that failed the Kinesiology muscle test. And that's why I then tested all the different angles of the knee before working out exactly which area needed a little assistance. Now, most people I treat absolutely love the neck area being treated. I think most of us have tension in our necks caused by incorrect posture, maybe too much strain in one position, either driving or at a desk or playing sport. And so by bringing the correct alignment, the correct targeted relaxation and energy between the vertebra in order to lengthen that neck or that spine, then this ensures the most amazing amount of relief and therapy for the client at this stage. It's so utterly relaxing that that's why, as core therapists, we treat the neck almost last in the core therapy treatment. The rest of the body will have been relaxed, helping the head and neck relax. You can see my fingers there just supporting and protruding into the area between C1, which is the very top vertebra, and the occiput, which is the base back of the skull. A lot of people have issues at that joint where the C1 may well have clamped tight against the occiput. This can happen in various sports, or trampolining, or falling over, whether as a child or an adult. Also as a whiplash and a sudden stopping movement in the car when our head flips back. And what unfortunately happens, well, actually fortunately, is that the C1 can attach itself quite beautifully, like a jigsaw piece, underneath the occiput. This has the effect of protecting the neck from breaking, but if left untreated, that C1 can remain attached to the occiput for many, many years, if not for life. It will then, over the time, affect mobility and flexibility. It may not even create pain, but it does in many people. And it leads to all manner of blockages, physically, but also mentally. For instance, headaches, lack of clarity. The glands may not work so well. For instance, the pituitary, which controls the release of all the hormones, the whole endocrine system. So that may include adrenaline from our adrenals. It may include the reproductive system. So even something simple like a neck release can help us in so many ways. Hormonally, and with reproduction, also with our stress levels, because of helping to create a balanced amount of adrenaline being injected into the body. Also with the thyroid, because of the thyroid gland emitting thyroxine. And how interesting, so many of us these days do suffer with a hypo or hyperactive thyroid gland, and all it may need is a neck release to help that pituitary gland to give the right signals to the thyroid. It's worth getting it checked out. So, having done a couple of neck releases where I've supported the very upper part of the neck with protruding fingers between the top vertebra and the occiput, I'm then helping to relax and push down away from the head and neck, those shoulders. You see Phil's head gently moving as I stretch the deltoid, the shoulder away. That's a really good sign. So while I'm supporting his head and neck with one hand, I'm also feeling the whole time what his head and neck are doing, whether they are giving in the muscle department, whether they are allowing and bouncing back. And that's a really good sign. That's excellent. It shows that there is some softness to the muscle, that it isn't hard and tight, strained. And now moving on, having treated the muscles and bones with the neck release and shoulder release, I'm now moving on to the Qigong, where, as core therapists, each Qigong treatment is called a float. So I am floating Phil's neck. It now feels really warm. There is an immense amount of heat and energy there. Phil's body and breathing has now reached a beautiful optimum level of relaxation. His shoulders are relaxed, his posture already, even in this lying down position, is much better. As I work on this area, I'm always looking down the length of the body as well to check his alignment, that the hips, knees, the feet and his chest are not twisted in any manner. For instance, with torsion, where a muscle might be tighter on one side than the other, and therefore bringing the angle of that body part over to one side. And whenever I do find something like that, I'll always work on that area. So I will not only work on a tight muscle, but I'll also make sure that the other side, maybe a slack or muscle that's too loose, isn't not working in some way because of a lack of connection. Sometimes, for instance, with a muscle, they can have a start and an end of a muscle, which is called an origin and an insertion. And sometimes one end of that muscle may have levitated away from the bone that it is connected to, and will need reminding how to reattach. And that is a technique I think I've shown you on here with Mirka's core therapy treatment called the origin and insertion technique. You'll notice within this Qigong treatment now that I have moved my thumbs up to touch the sides of Phil's temples. My hands are still relaxed around his upper neck and scalp. So I'm working on the occiput, the very top of the vertebra, and the temporals. I've got my eyes closed, and I know, without even asking Phil, that we are now tuning into exactly the same energy. It takes quite a lot of energy to create this beautiful feeling that does work between us, where I am simply facilitating and activating that energy that's always within us, and in this case it's within Phil, and reminding that energy, that beautiful life force, that it does have the power to relax and heal at the same time. And this energy will carry on working for Phil for several days after this core therapy treatment. And we are left with the most beautiful feeling of tranquility. Having updated my notes, I'm now asking Phil to take a couple of breaths, keep his eyes closed, and start having a sense of awareness, sensing his body, becoming aware of the room, becoming aware of how his body feels after a core treatment. Phil and I have taken several breaths together. And now I'm just asking him to become aware of his toes, his soles, and to just start giving them a little movement. And then to rotate into his ankles. I notice this a lot. A lot of people aren't particularly keen to start moving after a treatment. They're in such a relaxed state that their body is telling them that they should stay there for longer. And I understand that. Sometimes with people, if they're very relaxed, I will leave them for a couple of minutes and come back. But at some point, they do need to take ownership back of their physical body again, move into it, and be supportive, be present in the rest of their day. And now asking Phil to relax and move into his shoulders, rotating into the shoulder blades, moving into the hands, stretching the palms, circling the wrists. It's a really good action. You may want to follow along and do these actions at the same time. And breathing into the whole torso. And then when he's ready to, I invite him to raise his arms over his head for a nice long body stretch. It gives me the opportunity to stretch out and breathe, move into and rotate all of my joints, spine, at the same time as I talk my clients through their awakening. Having awakened the body. I'm now checking my notes to see which areas I need to retest that had failed at the start of this particular treatment. So this is a kinesiology muscle test. That was called an IPSY test, which is one-sided, one arm and leg, which had failed at the start of the treatment and it was strong. This is called a contralateral, which is now strong. That's a really good sign because that also shows that his left knee and left ankle are now passing. So that means I don't need to test those because the contralateral showed me that they will pass. This is a ballet test and it actually shows me whether the hip, in this case the right hip, is happy opening. I've got the foot positioned nearer to the knee and now asking him to relax his knee, his leg down, and to raise his left knee just to that middle position. And I ask him to hold his arm once he's relaxed the knee out. I ask him to lower his arm, it was too high, which I find a lot of people do raise their arms very high at that point. And he's passed all his tests, I'm really happy with that. So thank you for joining me. I see you again soon. Next week you'll be seeing my own core therapy treatment. Please subscribe. Thanks guys.